I want to talk about the struggle to prevent what is called medication overuse. Migraine patients use different types of over-the-counter and prescription medication to treat a migraine when they feel it either spiking, if you have chronic migraine, or when they feel it coming on. The problem is that migraine patients have rules that maybe some of the general population doesn't have when it comes to how much you can use a medication. The American Migraine Foundation has the criteria of medication overuse on their website, and so those technical scientific details and guidelines you can get from them, but I'm just going to talk about my struggle. So for example, Tylenol, NSAIDs, Excedrin, we can only use those, or I can personally only use those 15 days a month. So I have to keep track of and decide when I'm going to use certain medications, prescription and over the counter, to avoid medication overuse, which causes a worsening of migraine disease. So the trouble is that we keep these sheets, at least I do, where I mark what medication I use on what day. And most days I have to go back to this paper and calculate, okay, so I used my triptan twice this week, so I can't use that. So I have to go and use my other CGRP medicine that I can use 16 days a month. But that doesn't count my anti-nausea medicine for migraine that I can use 15 days a month. And it kind of goes on, and it's custom from each patient. So I'm not giving medical advice. I'm telling you my personal situation. So this kind of goes into that video that I made previously of the Cinderella effect of when am I going to function? What am I going to take, and can I take anything for this pain? Because when you run out of your medication that you're able to use, you have to figure out, what else am I going to do? Am I going to put an ice pack on my head? Am I going to use a neuromodulation device? What am I going to do? Because I can't take anything. So that is a little bit about my struggle with medication overuse.